Hello everyone. Today we are going to learn about pre-exposure prophylaxis. What is pre-exposure prophylaxis? Who is eligible for pre-exposure prophylaxis? How do you take pre-exposure prophylaxis? How effective is it? And what are some of the side effects of pre-exposure prophylaxis? So pre-exposure prophylaxis is what we know as PrEP. Okay, so this one, is the name suggests, it is pre-exposure, before you expose yourself to HIV. So pre-exposure prophylaxis is a medication that we take to prevent or to decrease the risk of being infected with HIV. So who is eligible for pre-exposure prophylaxis? One is a patient who has had, or a client, or anyone who has an increased risk of infection. This is maybe a patient who is a sex worker. Two, if you have sex with men, the MSM. Three, if you are a long distance truck driver. Okay. Also, another person who is eligible for who can take PrEP is a patient who has been treated for STI recently. Okay. Another one is you have a partner who is already HIV positive. Another person who can take the PrEP is a patient, or rather a patient who has had who have different sexual partners. Okay, a patient or a client who does not use condom consistently. Okay, that one is also eligible for PrEP. Another group which is eligible for PrEP is people who inject themselves drugs. Okay, those ones, they also need to be on pre-exposure prophylaxis to prevent them from getting or be infected with HIV. Okay, then another thing we need to learn about pre-exposure prophylaxis is we have different types of PrEP. We have the daily pill, we have the injectables. Okay, and the injectables, we have the 2 months injectable, the Cab LA, or what you call cabotegravir, and we also have the LEN. Okay, and then that one we inject it every 6 months. Okay, then we also have the event-driven PrEP. Event-driven PrEP, this one is mostly indicated for men who have sex with men. Okay, or even the transgenders. Okay, this one is, as the name suggests, it is event-driven. You take it prior to the event, or maybe as soon as you are done with the event, you can take the event driven. What are some of the side effects of the PrEP? One, we have nausea, sometimes give you headache. Okay, but generally it has very minimal side effects. Okay, another important thing that you need to know before you take PrEP is, one, you need to be HIV negative. Okay, two, you need to know that the PrEP do not prevent you from getting other sexually transmitted diseases. Also, it does not prevent you from pregnancies. Okay, so if you are among the groups I've mentioned, you need to see a health provider, your doctor, or you visit a facility where they have the PrEP. They will guide you accordingly. They'll also do the test and make sure that if you are HIV negative, then you qualify to get the PrEP. Remember, if you before even you take the PrEP, you have to be not you have to make sure you have not engaged in sex or any activity that would predispose you to having HIV in the last 72 hours. Because if you have had an event, or maybe a situation, or maybe you had intercourse, or maybe you used needles in the last 72 hours, you need to be on PEP and not PrEP. Okay, thank you. Hit that subscribe button on, turn on your notification. Let me know in the comment section anything you want to know about the PrEP, more questions, and I'll be able to answer them on the comment section. Thank you.